How are you guys doing today? This is Mike Johnson here coming from the Health and Hope Clinic Pharmacy, and this lecture video is going to be a video designed to help you determine the oral medication dosage schedule for all of the medications that we use to obtain all the medications we use for our patients that we obtain through national patient assistance programs. Patient assistance programs, also known as prescription assistance programs, so these are actually synonymous. Patient assistance and prescription assistance programs are programs that all the national drug companies use in order to help patients that cannot obtain very expensive non-generic medicines free of charge. Some patient assistance programs do have supplemental income programs, and they also have some copay programs. However, at Health and Hope, we do not facilitate those programs. We only work with the drug companies that have free medication supplement programs. So some of the more common companies we use will be ones with Pfizer, AstraZeneca, Novo Nordisk. These are all common companies. In the pharmacy, you notice hanging on the wall at Health and Hope that there's a sheet of paper with the top 28 most commonly used drug programs that we have through different drug companies, different manufacturers, and that'll help guide you on what companies we use in order to obtain medicines for our patients. So we do have a couple of very common oral medications that we use on a consistent basis, and I like to list a couple out here so that way they are quick to you. Maybe that when you hear a provider ask, maybe if you hear of a different provider ask for a similar drug, you can offer it as a recommendation in the supplement for the training for the Health and Hope Clinic Pharmacy pharmacists and technicians. There's a guide on what drugs we commonly use for patient assistance programs, but specifically for oral medications, there's some that you're going to see come more frequently than others. So first of all, what you're going to expect to see is Cymbalta. Cymbalta is a very common PAP oral medication. Again, this is PAP oral. Tablets or capsules, things that we can swallow. Cymbalta is very common. Celebrex is very common. Those are very frequent. Prestique is something that we're going to see pretty often. We often see some of our anti-diabetics like Glumetza. Glumetza is pretty common as well. We also have other agents that we can use to treat for our patients, and we also see drugs like Prestique, which is very common. We see Prestique very frequently. We also have erectile dysfunction drugs like Viagra and Cialis. Well, they're not the same thing, but the qualities of erectile dysfunction drugs. We see these six. I'd probably say we see these six pretty frequently. The first column more frequently than the others. But when we get them, we will have to recognize which ones are available through patient assistance programs. And if you ever need assistance, you can always go to a website called www.needymeds.org. Needymeds.org is a great resource that you can use, and they've actually determined for you which medications have national patient assistance programs that are free. So all you do there, you're just going to search. You can either search by pharmacy company, but I like to use the drug, and you can use the drug, and I usually use the brand name because usually the brand drugs are the ones that are going to be available for you. Those will tend to be the most common. I did forget one on here that we also have is Prozac. That's common. Lyrica is another common drug. This one is a scheduled narcotic. This one's a Schedule 5. So we don't actually keep this here on site, but they don't actually send this to our clinic. They send it to the patient's house. But we get Lyrica for our patients that have pretty bad neuropathic pains. So we have a good amount of drugs that we obtain for patients. So before we go into how to translate prescriptions written for PAP oral medications, let's just talk about the idea of patient assistance programs. The first idea that I want to emphasize to you is that the drug companies will send a supply of 3 months at a time. So they send a 3-month supply. So we're thinking 3-month supply. So it just saves in shipping costs. But a 3-month supply is pretty consistent, except for 2 different drugs. There are 2 different drugs which the drug company sends every 4 months. So if a provider writes for Prozac or Cymbalta, Prozac or, let me write that better so we can see it, Prozac or Cymbalta, these will order and ship every 4 months. So if you see these 2 drugs coming through, either one of these 2 drugs, you no longer are going to dose them for a 3-month supply. You're going to dose them for a 4-month supply. Second of all, when we go through some things that just screen me about oral medications, is that we have to sometimes translate the prescription to a 90-day prescription. So many times the prescriptions may be written for 30 days, and we will have to do the calculations to determine how much should be ordered over a 90-day period. So a lot of times the providers don't recognize, or maybe they don't realize, or maybe they forget that they're written for every 90 days and not 30 days. So you're going to have to translate, and you're going to have to calculate a 90-day dose. So that's something that's very common as well. You'll see this happening pretty frequently. And again, be careful, because if it's one of these 2, it will be a 120-day dosage. So they'll send 4 months at a time with 3 months. So next thing I like to think is that if the med is to be refilled blank times, I'm just going to say blank times, this will last 1 year. So let's think about what this blank is. If we have a prescription, under our left corner there's always a refill date. There's also a refill quantity, not a date. This refill quantity can say anything that they want. However, the date of the prescription will expire 1 year after the prescription's been written. So when we're doing a PAP, the prescription counts as 1 fill. And the amount of refills, we'll just call this X refills, will be X fills. So total fills will be equal to 1 for the prescription plus how many refills plus X. So let's think about this. If we have an RX that's good for 90 days, so 1 RX is 90 days, how many refills should it have so it's good for 1 year? I hope we all said 3, because this will give us 90 days, and here we're going to have 3 refills times 90 days. So this gives us 90 days plus, and we get here 90 days times 3 gives us 270 days, and this gives us our 1 year prescription. Okay, in the case of Cymbalta or Prozac, those fill for 120 days. So let's think. How many refills must we give if it's going to be Cymbalta or Prozac? Okay, I hope we recognize in this circumstance it's going to be 2. Here we're going to have the 120 days from the original script, 120 days, and the refills will be 2 times 120 days. And this gives us 240 days. 120 plus 240 gives us that 1 year. And I know that adds up to be 360. but that's the way it works. So I know some people that are more pedantic, they get a little obscure when we say what happens the other 4 days and what happens if it's leap year. This is the general way that the prescriptions are written and filled. So this hopefully gives you an idea of what we do when we get a PAP prescription for medications that we could not afford to purchase. However, we obtain for our patients free from the drug companies. We lobby the drug companies on their behalf. We work in collaboration with the Patient Assistance Department, the Prescription Assistance Department, who currently Art Hillis oversees, and he's got a great team who works diligently to make sure to obtain and acquire these medications on behalf of our patients. Our job, however, is to get the medication and get the prescription from the provider, whether it be a physician, nurse practitioner, physician assistant. It has to be one of those three. And then we have to translate the prescription and put it into our EMR med services such that it will equal 1 year dose. So it's imperative that we calculate the correct quantity so that way the patient doesn't lose out on their medicine. That way they don't miss out on medication that they need. So we have to translate the script correctly, we have to understand the SIG, and then determine the quantity. That's our job. And then once we input it into our EMR, which I'm going to do in a different series and a different lecture, then Patient Assistance Department, PAP, will take it from there. So our goal is to get the script, calculate the script, input the script, and then send it off to the next department. So let's go ahead and look at some practice prescriptions. So we're going to look at some practice prescriptions, and I'm going to go through a couple with you in this lecture series that I wrote out. This is for test patient, name test patient. This is an exact prescription that we would see at Health and Hope, and notice the drug here is Celebrex. 200 milligrams. It has the name of the drug and the dosage. We have to have the name of the drug and the dosage. We have a SIG, we have a dispense quantity, we have a refill down here, and we see the provider's hand. So first of all, I think to myself, I get out a little sheet of paper, and I say the name of the drug, and I see that that is Celebrex. And sometimes it's going to be tough to recognize and determine the name of the drug by the handwriting, but through practice, you'll start seeing them very frequently. And the dosage is 200 milligrams. So now we have the name of the drug and the dosage. So we got some checks there. Good, we're good. So now we have to translate the SIG. This will be the SIG that we're going to input into our EMR that will be printed off and sent to the National Drug Company, and it will also be printed off when the drug arrives and we give it to our patient. So they're going to use pharmacy SIGs, pharmacy abbreviations. So we're going to have to translate these, and we want to be specific to our patient. We want to be specific so the patient understands, and we don't want to try to abbreviate, be elaborate, make sure they understand the dosage. So let's look at this SIG. Hopefully we can all see this. This says take 1 tab. This should be PO, not PQ. POQD. 1 tab POQD. So in our SIG that we would type using all caps, which is much easier for patients to read. So we're going to say take. Here, since this is the value of the tab, we use the value 1. On your SIG in the EMR, we're not going to use these little quotes, but I want to make sure we recognize here that we're going to use a value of 1. We're going to say 1 tablet, PO, which translates to by mouth, QD, which translates to daily. So this will be the SIG that we will have on our prescription label. This will be the SIG that is sent to the National Drug Company. So now we have to calculate the quantity. And this is going to be a quantity for 90 days. For 90 days. Just so happens that Jessica wrote this prescription. She didn't really write the prescription. I just wrote her name on that. And but we're simulating a prescription. She wrote dispense 90. So she recognized, she says, okay, you know what? I've done a lot of PAPs before. I'm going to make it easy, and I'm going to make sure that there's 90. But let's make sure that we know they're going to be taking 90. If they take 1 tablet by mouth daily, that means each day they take 1 tablet. 1 tab. Let me erase that. Oh, that was big. We're going to take 1 tab. 1 tab per day. And we're dosing for 90 days, so we multiply this times 90 days. And look over here. My units cancel, day cancels, and day cancels. So I get 1 times 90, and this gives me a value of 90 quantity. So my quantity here would equal to 90. So in our EMR, when it asks for quantity, it's going to be a value of 90. This is relatively an easier prescription. And then our refills, we recognize if we write them every 90 days, this has to fill every 90 days, 90 for the first base script. We need to refill this 3 more times, so that will be a value of 3. So we've gone through this prescription, we will enter this into our EMR in the next video, and we will recognize that this is the correct way to annotate the quantity, the refills, the sig, the dosage, and the name of the drug. So hopefully we understand that one. Here I have another drug. So hopefully we can read this. If you want to, try pausing this video. Try pausing this video and see if you can figure this one out on your own. So hopefully you tried pausing the video and you figured whether or not you could do this on your own. So let's work through this together. So in this circumstance, we have our drug. And our drug is Keppra XR, which is an extended release drug. And the dosage is 500 milligrams. So the drug is Keppra XR, the dosage is 500 milligrams. We see here that we're going to have to translate the sig. The sig here will be take 1 tab POBAD. So be careful. This is take, in caps, 1 tablet. PO stands for by mouth. And BID stands for twice daily. One tablet by mouth twice daily. And be very careful. There is sometimes a common error that occurs in this circumstance where people say take 2 tablets once daily. So think about this. Let's say I said take 2 tablets daily. Is that the same as take 1 tablet by mouth twice daily? Assume take 2 tablets by mouth daily. So let me just erase that. Take 2 tablets by mouth daily. Are these two the same? No, they're not. This says take 2 tablets by mouth once daily. So that means we're popping 2 at once versus taking 1 by mouth twice daily. 1 in the morning and maybe 1 in the evening. So this is very wrong. Do not make that mistake. Be very careful about that. Taking 1 tablet by mouth twice daily is different than taking 2 tablets once daily. So this is very, very wrong. This is the correct sig that we will use for this prescription to enter it right here. So now we have to determine the quantity that we will ask the drug company for. So notice here, she wrote refills 1 year. She was busy seeing a lot of patients. She said, pharmacy can calculate and dose this because I'm going to get a new prescription to sign off, and hopefully the pharmacy can do it correctly. So actually, no, hopefully they have to do it correctly. So notice here, we take 1 tab by mouth twice daily. Think to yourselves, how many tablets will that be every day? Exactly, 2 tabs. So we have 2 tabs per day. And remember, Keppra, it's not Prozac, it is not Cymbalta, so it's going to come every 90 days. So we're going to multiply this times 90 days. Our days cancel. 90 times 2 gives me 180 tabs. So I will be requesting 180 tabs as the quantity. And we should recognize now the refills will be for 3. 3, 1 plus 3 gives us 4. 4 times 90 gives us 360. So our refills here will be a value of 3. So we've gone through, we've understood the prescription, we understand the sig. It was a little sloppy, but that's okay. And we recognize the provider's name is Dr. Ewart. Let us look at this one. Okay, so hopefully this has a flag that comes up in your head. First of all, when we look at the drug is Cymbalta, and the dosage is 60 milligrams. So notice this sig looks like the one before, however, is drastically different. Notice the sig that Dr. Ewart wrote was 2 tablets QD. Take 2 tablets, and this should actually be capsules. Cymbalta doesn't come as tablets, but capsules will be fine too. Take 2 tablets daily. And notice that is different than taking one tablet twice daily. In this circumstance, she wants the patient to have an initial dose of 120 milligrams. She wants to give 120 milligrams all at once, which is different than giving 60 in the morning and 60 in the evening. So this is take 2 tablets daily. So in this circumstance, now we have to determine the quantity. So hopefully this raised a flag in your head and you said, oh, this is Cymbalta. This drug company, Johnson & Johnson, sends every 4 months, does not send every 3 months. So now we're going to have to dose this for 120 days. So if we take 2 tablets daily, that'll be 2 tabs per day. And we have to multiply this times the amount of days, which will be over a 4-month span of 120. 120 times 2 gives us, oh, this would be 120 days. I should cancel my units. I apologize about that. And this would give us a total quantity of 240 tabs. So here we'll enter a quantity of 240 tabs. And the refills here, remember here we're refilling every 120 days. So our base fill has a 120-day period. Our base prescription has a 120-day period. With the refills, no, she wrote for 1 year. Okay, that's okay. We can do this we can do this here in the pharmacy. So notice that will be refills times 2. So refills will be times 2. Okay, because Cymbalta, Prozac, they dose slightly different. So notice here we have Neurontin. Okay, so Jessica Han came through and she said, you know what, I want to write a patient for Neurontin. So the drug here is Neurontin, and the dosage is 800 milligrams. The sig here would be, and if you guys want to pause the video to try this on your own, pause it in between and see how you do. That's a good practice, so pause and learn, pause and learn. The sig here, take 1 tab POTID. So this will be take 1 tablet by mouth 3 times daily. So notice here, the 3 in the directions is not a value of 3. It's not the numerical value of 3. The only time we use a numerical value is when we describe the quantity to take. So if it was take 2 tablets, this would be a 2. If it was take 3 tablets, this would be a 3. But if it's take 3 tablets by mouth 3 times daily, we write out the 3 in the directions, and we keep the numerical value when it describes the quantity. So notice here, Dr. Ham wrote for 90. She said 90. Okay, let's think about this. She wrote for 90 with 11 refills. So, okay, what happened here? This is interesting. Why would she write for 90 with 11 refills? We know that she's very fluent in prescription. So let's go ahead and assume that we're going to calculate a 3-month quantity. So if she takes 1 tablet 3 times daily, she takes a total of 3 tablets per day. So she's going to dispense. We're dispensing every 90-day period. That means every 90 days, we're going to go through 270 tabs. Wow, that's a lot. That's a lot of tabs. That's a lot of tabs. And notice here, for some reason, she put refills to be 11, but we know that PAPs have to dose every 90 days, unless Cymbalta Prozac. So this refill should be a quantity of 3. So I do expect that, Jessica is very, very understanding. She knows the way this stuff works. And it just so happens this is a drug that's not available through prescription assistance programs. Neurontin used to be available through prescription assistance programs, patient assistance programs, however, no longer is. So this drug should not have been a PAP drug. So what probably happened was that this drug was supposed to go to the patient, and the patient was supposed to take it and fill it at a pharmacy separate than Health and Hope, but somehow it came over to us. So hopefully this is a flag that sort of shows up in your head. They said, okay, you know what, most of our providers, I'd probably say all of our providers that volunteer and work at Health and Hope to take care of our patients, they know that PAPs come every 3 months. She wrote for 11. That's not a common mistake to have. So in this circumstance, consult someone, ask someone, and make sure that this is a PAP that we're supposed to be pushing through versus the patient not getting this prescription and thinking that they're going to have this medication brought in from a national pharmacy company, national pharmacy manufacturer for free. So always, again, as I say, if you're ever confused, you can ask a pharmacist, ask Art or one of his PAP colleagues in the PAP department, or consult needymeds.org. So this goes over several of our oral medications that we use pretty frequently, and how to dose and quantify the prescriptions that come in for the oral meds. If you guys have any questions, please let me know. My name is Mike Johnston. Never feel bad asking me. I'll be more than happy to meet with you and discuss this, so that way you understand it further. We'll do some more practice. My email is mjohnston@healthandhopeclinic.org. I'll write that on here so we can all see it. So it is mjohnston@healthandhopeclinic.org. In our next two videos, we're going to be going over how to do the same application process for two different types of medications: inhalers, which also would qualify anything that we have to breathe in. We're also going to see that same way that we're going to do it using insulins. So insulins, we do a lot of patient assistance programs for insulins. Insulin's very expensive, and diabetes is pretty rampant. So any questions, let me know. Otherwise, you guys have a great day. Cheers.